Hello, my name is Kiana James, and I will be reading an essay on the causes of and solutions to teen pregnancy that I wrote for my English class. Teenage pregnancy is defined as an unintended pregnancy during adolescence. Approximately 750,000 of 15 to 19-year-olds become pregnant each year, according to the American College of Obstetricians and Gynecologists. Teenage pregnancy hinders society by increasing illiteracy rates because pregnant teenagers cannot pursue their higher education due to extra responsibility. In the United States, the annual expenses to fund the teenage pregnancies cost around $7 billion. The government has to spend money on public assistance, child health care, and foster care. In addition, teen moms do not have to pay some taxes, and the government has to face a huge loss of revenue. Teenage moms are more prone to committing suicides as the embarrassment and the lack of social support can cause them to become depressed. Emotional stress, financial crisis, and societal alienation are some of the main contributing factors that trigger suicide among teen mothers. Teenage pregnancy hurts society more than it helps, thus it is an issue that needs to be solved. The lack of knowledge on abstinence, contraceptive techniques, and the consequences of pregnancy increases teen pregnancy rates. Although there are many different ways to prevent a teenage girl from becoming pregnant, the only way that is absolutely effective is sexual abstinence. This method is the only one that guarantees no risk of getting pregnant. For many years, abstinence has been viewed as a decision based upon religious or moral belief. In the article Promotion of Sexual Abstinence, Reducing Adolescent Sexual Activity in Pregnancies, Hani R. Kazom says, sexual abstinence is not associated with the public risks and needs to be presented and promoted as the most effective primary prevention for unplanned pregnancies. In this article, Dr. Jocelyn Elders proposes teaching sexual abstinence as prevention for pregnancy, not as a religious or moral belief. According to Kazum, in a study involving 7,000 Utah teens, the students were taught one of 3 abstinence curriculums stressing abstinence as a pregnancy prevention method. They were surveyed 3 times based on their attitudes on the issue. After taking the abstinence curriculum, the studies found that from these students, a significantly higher percentage of them remained virgins than those who did not complete the program. With results like this, it becomes evident that abstinence courses in schools are a way to get teens to realize the responsibility that comes with becoming sexually active and to get them thinking about choosing to remain abstinent. The more information teenagers are given on the subject, the higher the chances that they will make this decision. For this reason, it is important that teenagers be taught the health benefits of choosing to remain abstinent. Another form of teenage pregnancy prevention that is being taught in schools is contraceptive techniques. Although abstinence remains the best way to prevent pregnancy among teens, it is a fact that there are still a large number of them who will be involved in sexual relations. For this reason, it is important that teens be provided with broad information on how to do so responsibly, using various contraceptive techniques. Most of the sex education in schools consists of one message: don't have sex, but if you do, use a condom. The problem that rises from this is that teenagers are not being exposed to information on the various forms of birth control, condoms, and other methods of prevention that are available. According to Helen Lippman, contraceptives are talked about in sex education class, but only as being ineffective in preventing pregnancy and diseases. Also, these classes on contraceptives should include information on how to obtain the different methods of birth control. Jocelyn Elders has also advocated school-based health clinics nationwide with the purpose of reducing teen pregnancy with the availability of contraceptives. This is a way to ensure contraceptive use for many young teens who, rather than going to their parents for help in obtaining birth control, choose to have sex without protection simply because that protection is not made available to them. If teenagers knew the real consequences of having a child at such a young age, they would not be able to be pressured into becoming sexually active. Teens need to be aware of the harsh reality of raising a baby and the negative effects that an unplanned pregnancy can cause on both the mother and the child's lives. In the article, The Decline of Teen Marriage is a Serious Problem by Patrick F. Fagan, Patrick F. Fagan discusses the effects of having a child out of wedlock at a very young age. He states that the mother's new offspring can experience lowered health for newborns and increased risk of early infant death, retarded cognitive, especially verbal development, lowered educational achievement, lowered job attainment, increased behavioral problems, lowered impulse control, rapid social development, and increased welfare dependency. Teenage mothers must be aware of the effect of their offspring. Teenage mothers must be aware of the effect their offspring will have on society in the future and the high risk of the cycle repeating once this child becomes a teen. Teens must also be aware of the fact that an unplanned pregnancy will take a toll on other aspects of their lives. For example, as Fagan points out, less than 1/3 of teen moms who have a baby before they are 18 finish high school. When exposed to such information about the results of an unplanned pregnancy, teens are forced to analyze whether sex is worth the risk of forever changing their lives and those of their future children. There is a large number of teenagers that become pregnant before they are mature enough to be. Teenage pregnancy hinders society by increasing illiteracy rates, decreasing government revenue, and increasing suicide rates. But the issue of teen pregnancy can be solved by teaching teens about abstinence, contraceptive techniques, and consequences of pregnancies, since lack of knowledge of these causes teen pregnancy rates to rise. Thank you for listening to my essay. If you could just read the description that I provided in the little description area, I guess, and just follow those directions, that would be greatly appreciated. Have a good day.